It's my privilege to introduce to you Debbie Sprague, an author of the book Stranger in My Bed and 8 Steps to Taking Your Life Back from the Contagious Effects of Your Veterans Post-Traumatic Stress Disorder. That's a long one.
We did not figure out how to say it in a
shorter way.
We tried.
Debbie tells us that she has personally experienced the challenges of caregiving during her son's losing battle with cancer and caring for her late mother-in-law. She currently cares for her mother and father, both suffering with dementia. In the year 2004, Debbie's husband, a Vietnam vet, was diagnosed with complications from exposure to Agent Orange and post-traumatic stress disorder. Life dramatically changed for them, and in 2006, Debbie herself was also diagnosed with PTSD. Debbie then used her gift for creating programs to take on the challenge of finding answers and solutions for spouses who become overwhelmed and lost in the world of caregiving and PTSD. She earned her bachelor's degree in therapeutic recreation with a minor in psychology, graduating with honors from California State University. Debbie is also a board-certified life coach, specializing in wellness and life solutions for caregivers and families of veterans suffering from PTSD and traumatic brain injury. She is a recreation therapist and holds a community college teaching credential in health and physical care services. Debbie is also a member of Mount Calvary Lutheran Church in Redding, California. Debbie will tell us that recognizing and helping an individual or family suffering from the effects of PTSD, from the effects of trauma can be difficult, Gaining a deeper knowledge of PTSD can help parish nurses or the nurse in the parish to care from the heart with understanding and compassion. Her presentation will include a comprehensive overview of PTSD, including the effects of PTSD on spirituality. PTSD also has strong implications on family members. Nurses will learn how to recognize secondary stress disorder with special emphasis on caregivers and children. The connection between PTSD, suicide, and family will also be examined. Participants will be provided with resources and suggestions to help identify and assist individuals and families that may be in crisis due to PTSD. Please join me in welcoming Debbie.
Thank you so much, and it's just such a pleasure to visit Wisconsin for my first time. And as some of you know, I was supposed to be here in September, and due to a family situation, had to cancel at the last minute. I do appreciate all the prayers that came our direction last September. My daughter lost their child to a stillbirth, but God's blessed them with another pregnancy very quickly, and we're expecting a new baby in August. So thank you for all your prayers on that. So it's been a long day, lots of wonderful information. What we're going to talk about today, PTSD is an invisible wound, so that's definitely something that as nurses, as spouses, as caregivers, we really need to care for people through our hearts. And before I start the presentation today, I'd like to do a little exercise with you. I'm sure none of you are stressed or from this long day of all the wonderful things you've been listening to and learning. So let's just take a few minutes to really find our heart place. Is that okay? Okay. So it works best if you close your eyes, but if you're not comfortable with that, that's okay too. Okay, so what I'd like you to do is just 3 easy steps. Just take a couple minutes here. So I'd like you to put your hand over your heart. Okay, and I'm going to teach you what's called the inner ease technique. Just the simple act of putting your heart over your hand over your heart can start the flow of oxytocin, which a lot of people call the love hormone. So just sit there for a moment and just feel your heart. Now I'd like you to take a deep breath in, breathe right in through the center of your heart. Visualize what your heart looks like. As a nurse, you might be looking at the anatomical heart. Just breathe in and out, concentrating on breathing right in through your heart and exhaling normally. Okay, this time when you breathe in through your heart, breathe in love, ease, and compassion. And exhale. And again, breathe in love, ease, and compassion right into the center of your heart. And at your own pace, go ahead and continue that a few more times. Okay, one final time, a deep breath, breathing in love, breathe in ease, breathe in compassion. Let your breath out. You can open your eyes. You feel any different? Feel a little calmer? Don't go to sleep on me though. I have lots of pictures for you so that you won't go to sleep. So caring from the heart, that's what you all do every day, especially as a WELSNA nurse, right? It's so important, and you've learned so much today about the variety of ways that you can care through your heart. And as you already heard, the key points I'm going to go over with you today, and just real quickly, I'll go through them again. The overview of PTSD and the effects on spirituality, secondary stress disorder, and the relationship between PTSD, suicide, and families. If you were here this past hour and heard the presentation on suicide, I'm going to go a little bit further and just share with you how that relates to PTSD and what PTSD and suicide have in common. Also, how you can identify and help families in crisis. And then I'm going to leave you with some resources. I think the best, I know all of you have probably learned about PTSD in a clinical setting, you've learned from the book about PTSD, but I'd like to take that further and actually share with you my personal story. Often when you can see PTSD in real life, it really gives you a deeper understanding and really can hit home with you a little bit more than just reading about it in a book. But okay, you hear my story?
Mm-hmm.
In, let's see, 1996, my life was everything I had ever wished for. Just the perfect life I had dreamed of when I was a little girl. I was married, I had two beautiful children, Aaron and Andrea. I had a great job as executive director of a nonprofit. My family all lived together in Reading, we worshiped together. My parents, my siblings, my nieces and nephews, we all worshiped together. Everything I could ever have asked for. But soon after that, my life fell apart, things changed. My marriage ended, and in 1993, my son Aaron, who was 10 at the time, was diagnosed with an inoperable malignant brainstem tumor. And 5 months later, he passed away. A very horrible time in our life. But thank you to my faith, my family's faith. In the Lord's help, I had the ability to move on. My little girl was 7, and of course she needed 8. I had gone back, well, I had never really left my job with the nonprofit, but after my son passed away, I just found it so much harder to go to work every day and work with people that were poor, that were suffering, that every day they had a painful situation. But in God's perfect timing, I had an unexpected job offer, and I went to work for a travel company. I was working with healthy seniors, helping them bring their retirement dreams to life by planning and escorting group tours. Well, one morning in 2000, standing in a muddy parking lot, 6 o'clock in the morning, I was going to take a group out on a bus tour, and I went to a meet the bus driver, new employee, his name was Randy. We shook hands, and that was it. He was, if you don't believe in love at first sight, it happened that morning. And he began going to church with my daughter and I. He soon started going to confirmation classes. He was baptized, and he became a very involved member of our church. And just, we had the family that he had never had, and he quickly became a very important part of our family. So 8 months from the day we met, we got married. And we were really looking forward to having a wonderful Christ-centered life together. He was my best friend. My daughter adored him. And during the time I was single, she didn't want me dating. She did not like anyone that even talked to me. So for her to like this man was pretty important. But by 2004, things began to change. He started having nightmares. He would scream in Vietnamese. He would use words, swear words that I had never heard him use when he was awake. I'd wake up to a fist in my face or him punching me, kicking me. He was on guard all the time. He went out and got a concealed weapons permit and would carry his gun everywhere, even to church. And he couldn't sleep. He was on guard all the time, checking all the doors. He would be awake all night long. And sleep deprivation took a toll on him, but it also took a toll on me. He began having angry outbursts. It left my daughter and I walking on eggshells because we had no idea what it was that he did to cause these outbursts. Just some innocent thing that was nothing, and he would have these angry outbursts. He would go days without speaking to me. It was just like he was engulfed in this dark cloud, and I had no idea what was going wrong, and he would withdraw from everything. He no longer wanted to go places with me. Any place that involved crowds. This happens to me when our daughter's wedding. But church became a place that he wasn't comfortable with anymore because of the crowds and sitting where people were behind him, and he had doors were behind him and he didn't know who might come in. Eventually, I became very angry too. I became angry at him because he was ruining my life. I mean, he ruined so many special moments in my daughter's life. All the hopes and dreams we'd had for our future just seemed like they were gone. And I didn't know why. I didn't have any idea what was wrong with him, why he was acting this way. And I wasn't ever an angry person. So for me to feel that way was really difficult. And that anger and resentment, on top of that, I started grieving. I started grieving for the loss of my husband. So many parts of our marriage were gone, and I believed that they would never come back again. So I basically went through the same stages of grief that you go through if you lost a loved one to death. But my loved one was still living. So it's very easy, not easy, but it happens that you grieve the living who's sitting right next to you, which in a lot of cases can be so much worse because that person changes, but every once in a while a glimpse of him would come back again, and it would give me hope that things were going to change. And the next day he'd be right back to that stranger that he had turned into. He became totally out of control, and he began hurting everyone close to him. He started abusing prescription drugs. He was in a lot of physical pain, and the pain medication wasn't enough, and they kept giving more and more stronger doses of pain medication until eventually he was on morphine. Between morphine and drinking, he was on the road to self-destruction. And I had no idea why this was happening when I didn't know how to help him. His angry explosions would come out of the blue, and it affected my daughter. It affected her friends. He basically ruined every important event in her life. When she went away to college, by the way, she's a nurse today, but when she went away to college, she never came back and slept in her own bed again. She told me, you know, I'm just afraid to be around him for more than a couple hours. And she had good reason to feel that way because of all the things for her important high school years that had happened. And losing my daughter, it really put me in a whole different place. I was very depressed. You talked about not wanting to live, but not wanting to commit suicide. I mean, I really felt that way. I wanted to sink into my mattress and just kind of disappear. And I told my husband that one day. I told him, you know, I just not interested in life anymore. And he just looked at me and he said, I can't help you. And he walked away. There I was. Well, I believe that we had a divine intervention. One day my husband was standing in a parking lot waiting for me. He was standing outside the car, and he saw a man walk by with a hat on, Vietnam vet, Purple Heart on the side. And my husband yelled out to this guy and said, "Welcome home, brother." So that man walked over, and they shook hands, and they started talking. Well, this man asked my husband some very pointed questions. And then he said, "Are you getting help?" My husband, "I don't need any help, I'm fine." And this man said, "No, you're not." The next morning, that man showed up at our front door. He virtually took my husband by the hand, took him down to the VA, walked him in the door and said, "This man needs your help." And he did. So very shortly after that, my husband was diagnosed with a variety of health issues from exposure to Agent Orange, but he was also diagnosed with post-traumatic stress disorder. 30 years after the Vietnam War, this all came back. So, what is PTSD? And for you as nurses and those who care for people, I've talked to a lot of people, some working at the VA, some working with all kinds of different groups that you might encounter people with PTSD. So it's so vitally important that you recognize the symptoms and recognize what PTSD is. The person that saved our life was another veteran. You very well can be the person that saves the life of someone in your congregation, in your workplace. So education is so important, and that's why it's my passion to share my life, my experience with all of you. Oops, I pushed the wrong button too fast. Okay, so what is PTSD? It's a normal reaction to a very abnormal situation. That was a simple explanation, but as nurses, I know you want to know the more intricate one. Okay. Just a minute. You had this working perfectly. I'm messing it up here.
There you go.
Okay. The latest edition, I'm sure you're all familiar with the DSM the latest edition of the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders, as well as acute stress disorder. It moved to the class of anxiety disorders into a new class of trauma and stress-related disorders. So all of the conditions included in this classification require exposure to a traumatic or stressful event as a diagnostic criteria. The DSM-4 did not have a criteria of actually having to be firsthand in the trauma. So who gets PTSD? A lot of people connect it to someone that is in the military. And you're right, there's many people in the military that are in combat that have PTSD, but you don't have to be in a war zone. People that are in a combat situation, definitely, but nurses, people that are in a situation where they're feeling danger or they're seeing people that have been harmed, they're afraid for their own life, they all can also be affected by the trauma and by PTSD. Also, physical and sexual assault, children, adults. In the session that we just had a while ago, the New Beginnings, talking about a lot of the young women that come in there are victims of sexual assault. That's another place you might very well find people suffering from PTSD. Undiagnosed, more than likely. Automobile accidents. But not just the person in the car, but the first responders, firemen, policemen, the first responders. Natural disasters, tornadoes, hurricanes, earthquakes. So Haiti, the people that were exposed to the devastation of the earthquake in Haiti definitely could be subject to PTSD. There's a lot of conflicting views on PTSD. Some people don't believe in it at all, and many people believe that it goes as far back as the Bible. So one story in the Bible that really highlights PTSD could be the story of Job. I'm sure you all remember how Job went through such extreme suffering, the loss of material possessions, extreme grief, and the fact that he had so much mental and psychological anguish that at one point he didn't want to go on. Does that sound like what we've just been talking about? Yeah. Many of the ways that Job is described in the Bible have exactly the same symptoms as you'll find in the definition of PTSD. So now we're going to go over some of the symptoms of PTSD. There's lots of different symptoms, and there's different categories that they fall into. And as I go through this, I want you to think about my story, what I shared with you about my husband and my own things, and see how they connect. So the first category is intrusion. It's also called re-experiencing. Those are the nightmares, the flashbacks. A lot of vets have problems with flashbacks, where all of a sudden they feel like they are right back in the middle of combat, right back in the middle of a traumatic experience. So much to the point where they cannot separate themselves to be in the present. And great feelings of distress. Some of the other symptoms are being triggered by events that remind you of the traumatic event. It could be smelling diesel fuel. It could be hearing a helicopter fly over. For a lot of our vets coming home now, I mean that's a crumpled up paper bag, okay? our vets today, because so many bombs are placed in McDonald's bags, crumpled up on the street in Iraq and Afghanistan, just driving down the street and seeing a crumpled bag can set them off. It can trigger them.
Soda cans too.
Soda cans too. And each vet or each person that's had a traumatic event, some of the triggers are fairly similar, but everyone has some very unique triggers to them. And as a nurse, why do you think it would be important for you as a nurse to know what someone's triggers might be? Like when my husband, and this is very so common, when he first came home from Vietnam, he told me he was sleeping on the couch and his little brother came up and he was a smoker, because he came home from Vietnam as a smoker, took the package of cigarettes out of his pocket. Well, that startled my husband, and he jumped up and he put his hands around his little brother and threw him on the ground. You don't wake a soldier up with PTSD.
You better duck quick.
Yes. There's also actually physical responses to PTSD. There can be surge in heart rates, profuse sweating. So it's not just psychological, it actually has physical symptoms as well. The next area of symptoms is called avoidance. So they avoid talking about the event. Well, they also avoid getting help because they know if they don't get help, that the first thing that's going to happen is somebody's going to want them to talk about it. So many people do not want to talk about their traumatic event. Avoid driving if you've been in an automobile accident, if you were in a combat situation where some of your fellow soldiers were killed, then you don't want to drive. Avoid watching war movies. This one's kind of funny because it goes both ways. Either some vets don't want to watch war movies at all, and the other extreme is that's all they watch. It's funny, it goes both directions. Avoiding crowds and noise. That's a real trigger for a lot of vets and a lot of people that have PTSD is having a lot of noise and crowds because they don't feel safe. Also feeling like your life will be cut short. They feel like they don't have much life left, which causes a lot of additional problems. Risky behavior. I'm going to die anyway, so it doesn't matter if I drive fast. It doesn't matter if I do things that are risky. And also it creates financial problems because I can spend all my money today. I don't need to save it. I don't need to think about my retirement or my family next year because I'm not going to be around, so I don't really care. And so a lot of our veterans have serious financial problems because of feeling their life's going to be cut short anyway. Another way of avoidance is to become a workaholic. If they're working all the time and concentrating on something else, then they're not going to have to think about that traumatic event. And there's some other types of avoidance that aren't so healthy as well. I mean, it's not healthy to be a workaholic, but using drugs and using alcohol is also a very common part of avoidance. Obviously not very healthy to go that direction, but very common. And the third area of symptoms is feeling numb. And this is actually one that they've just added during the last revision in the DSM. So no longer interested in activities that they used to enjoy. Just feeling in a negative state all the time. Finding it very hard to experience emotions. Basically just being an iceberg. Not caring about or feeling your own feelings, but also not feeling anybody else's feelings. It made so much sense to me when I understood why my husband was being so cold to me and why, if I was having problems, if I was sick, if there was something going on in my life, how he didn't care. There was no reaction. And And that can be very difficult when the person that you love doesn't care about you, doesn't care that you're hurting, either emotionally or physically. Today I understand why. It's also very common for them to blame other people and for things that they don't want to take blame for, so blaming. And the fourth area is hyperarousal. So difficulty sleeping. They can't sleep because they're keyed up all the time. They're irritable and angry outbursts. A lot of trouble concentrating. I had a really hard time concentrating when we were in the midst of my husband's, the height of his PTSD. It would take me days to do something that I should have been able to do in an hour. Just the jumpy and feeling startled very easily. And we just talked about that as well. And then reckless and destructive behavior. I'm talking about suicide and how many suicides in veterans. There's actually 22 veterans per day that commit suicide. But a new report just came out from the Department of Defense about how many more they believe there are because of the reckless and destructive behavior. They were citing the number of automobile and motorcycle accidents from vets, especially vets with PTSD. Those weren't counted as suicides, but more than likely, a big part of those, they intended to end their life. They also feel like there's danger lurking everywhere. As I said, with my husband, he went through a stage where he needed to carry his gun everywhere. We're going to at church one day, and I didn't know he'd gone and got a concealed weapons permit. I didn't know he had gone and bought a pistol. He did this without me knowing. Well, one day we're sitting in church, and I see him leaning over to my brother-in-law, and they're both patting their sides. I'm thinking, what is that? What are they doing? Well, we get up to go to communion, and he's standing in front of me while we're waiting to walk up. And I kind of put my hand on his side to tell him it's time to go. And there's this cold, hard thing on his side. I'm thinking, what is that? So when we get back to the pew and sit down, I said, what is that? And he says, oh, it's a CCW. And I said, oh, what's that? And he goes, oh, I have a concealed weapons permit for church. That's how unsafe he was feeling. And then, again, we talk about the physical health problems. Chronic pain is a very common problem that comes along with PTSD, sexual dysfunction, and then health exposures from hazardous substances. For our Vietnam vets, that's Agent Orange. Our vets coming home today are having numerous problems from all kinds of different chemicals that they're being exposed to. The list is just gigantic on all the different things that are happening with them. And then another one is, that's actually can be a part of PTSD, is being overweight and obesity. And the longer that people that have been exposed to trauma that have PTSD, the longer they go without treatment or being undertreated, then the more difficult it is for the treatment to work. In my husband's case, it was 30 years, and he was told that the very best we could hope for in his treatment and his recovery was 50% better of his symptoms. And so today, he's better. He's on medication, he's gone to therapy, he's gone to group therapy. I know what's going on now, so I can help him definitely more than I could when I had no idea what was going on. But he will never feature of PTSD. He knows how to handle things better. I know how to handle things better. I know to help him not be in situations, but he works really hard at controlling his symptoms. And that's the key. If he was here, he would tell you that the most important thing in treatment is that you have to want to get better. Because if you don't want to get better, nobody else can do it for you, so you have to have that desire. And having our faith has been such an important part of his healing process. When we met, he had been exposed to church a little bit in his very young years, but it was something that when we met and he started going to church with me, and he saw how important our faith was to my family and to me and to my daughter, and things that our family had gone through, losing my son. You know, without our faith, I would have never been able to get through that. So he was able to see what a difference Christ made in our life, and he embraced that faith, and it's a huge part of what's helped us to get through. I know we couldn't have done it without it. Which brings us to spirituality. This is often something that a lot of people don't talk about. It's sort of one of the hidden parts of PTSD is the effects it has on spirituality. I mean, in our setting here, we do talk about it, but if you went to a presentation on PTSD, you know, out in the community, it's something that you may or may not, talk about it. So the 4 things that we're going to talk about is the meaning and purpose of life, guilt and forgiveness, abandoned by God, strength and faith. Spiritual pain can be just as difficult as physical pain. And so it's so important that we recognize the part that PTSD has in that. So let's talk a little bit about meaning and purpose of life. That's something, whether we recognize it or not, every single day of our life, we think about these things. We think about who we are. We think about what our life purpose is. And we think about the meaning of our existence. Oftentimes, if you're working with, for instance, a World War II vet or a Vietnam vet, someone that's getting close to the end of their life, this is an especially important time when people stop and they review their life and they think about things they've done, things they didn't do, and how that all makes sense and how that fits into who they are. Well, that's also a time when PTSD can come out in a person that's never had symptoms before, because they start thinking about things they did in the war, trying to make sense of it, trying to know, why did I do this, and making sense of it all. Guilt and forgiveness. This is especially true for our soldiers, but also for anyone that might be in a trauma. Sometimes you wonder, could I have done more to help that person who was next to me that died? I lived, they died, and they're guilty. They feel guilty about that. Sometimes that guilt is real. Sometimes they really could have done something more. But often it's perceived guilt. They're thinking that there's something more they could have or should have done when there really isn't. But to them, that perceived guilt is just as strong as real guilt. And forgiveness. Oftentimes, a veteran might believe that despite God's promise and despite that they know God's promise, that what they did is unforgivable. That God couldn't possibly forgive this sin because this was such a horrible act that they committed in war. Another area is feeling abandoned by God. You watch things happen around you, things happen to you, and you wonder, how could God let this happen? How could God love me and still let these horrible things happen to me? So people that may have had great faith before their trauma, it's easy to lose their faith because they're feeling like God's not there. But on the reverse side of that, for some, after a trauma, you actually get a stronger connection to God because you realize God was with me. I came through that situation and He was there with me and He kept me safe. And it's also a wonderful opportunity for people to be able to minister to other people and share their faith. You know, that person sitting next to you in the foxhole that may be struggling with their faith, it's an opportunity. So we've talked a lot about the person that's suffered from the trauma, but so far we haven't talked much about the people around them. I've shared a little bit about what happened with my daughter and I. Well, my daughter and I were very fortunate that my husband did get help right away. But when he started treatment, nobody told me that he was going to get so much worse before he got better. So just imagine 30 years of traumatic experiences pushed down and then erupting like an angry volcano. And we struggled through that. We struggled a lot. And I felt very much alone because nobody around me understood PTSD and they had no idea what I was going through. You know, when my son was diagnosed with cancer, all of a sudden I was surrounded by people. My church family, my friends, and even total strangers stepped up to help me through that difficult time. But when my husband was diagnosed with PTSD, and I tried to explain to people what PTSD was, I would get things like, there's no such thing as PTSD, it's just an excuse for his bad behavior. Or, you know what, he's just after the money that he can get from the VA if he says he has PTSD. And then there's the people that just, flat said, there's no such thing. So there was lots of blank stares and lots of loneliness for me because I couldn't talk to anyone because no one understood. So when I finally was at the lowest of lows, and my husband, as I said, I can't help you. Well, the next day he showed back up and he said, you know what, I can't help you, but you probably need to go see somebody. So I reached out to 2 different therapists, and both of them told me the same thing. You know, you're young, you've got PTSD as well, this is ruining your life, you just need to walk away. Just divorce him and just walk away. So they offered me no solutions, no help. They just said, take the easy way out and walk away. So I thought about that. I thought about what they had said, but I also thought about my husband and how he was only 19 years old when he went to war for our country. And that I loved this man, despite being very angry with him, being very resentful of him. I loved him anyway, as we heard earlier today. So I thought about it and I decided that I was going to walk away. So I walked away from the therapists. And I thought, you know what, if I'm going to do this, I guess I'm going to have to do it a different direction because I wanted to honor my marriage vows. I wanted to help my husband. So I turned to the Lord, and I found the strength to start dealing with all these things that had been going on with me and with my husband. So I started researching everything that I could find about PTSD, and I started reaching out and finding other people that were actually going through the same thing I did. I didn't find anybody in my community. I did find some online communities where I was able to connect with people that understood what I was going through. And I was given this piece of advice. The best way to help yourself is to reach out and help other people. And I also found out that there was really, I personally was diagnosed with PTSD, and I think a lot of that had to do with the traumatic events I went through with my son's situation. But there's a very common situation that happens with many people, and it's called secondary traumatic stress. Those of you in the helping profession, you're very susceptible to this as well, because it's stress caused by providing help, offering emotional support to a traumatized person. And all the symptoms are almost identical to PTSD, but the difference is you haven't had direct exposure to the traumatic experience. So these are probably going to sound familiar to you. Symptoms: loss of interest in things you used to enjoy, insomnia, chronic fatigue, changes in your self-perception, and changes in perception of your own life. And then there's also the physical things that come along with secondary traumatic stress. You're more susceptible to infections, to headaches, to indigestion. And you're also more susceptible to addictions: smoking, alcohol, food. We're all addicted to chocolate, right? Anti-prescription medications. So what happens is people start mirroring the behaviors and the actions of the person with PTSD. So you take on their symptoms. If they're upset and angry, you become upset and angry. And this can happen not just to a spouse, but to everyone who's in close contact: parents, grandparents, and especially children. So it's especially important that you watch our children, and the teachers in our schools have knowledge of PTSD and some of the symptoms to look for in children, because they can be really severely affected by their parents' PTSD. Now, living with PTSD can also make you more susceptible to suicide. We talked about depression and anxiety disorders. Those are things that can lead to suicide. Secondary PTSD as well: stress, social isolation, and then of course having access to lethal methods. And how about the suicide survivors? All the family that's left, the friends, the spouse, the children, they're 40% more likely to consider suicide themselves. So what do we do? Where do we go from here? And at this point, I'd really like to open it up to you. I'm going to open it up to questions, but also I'd like you to know the 3 things that I've learned that people with post-traumatic stress disorder need the most: compassion, understanding, and empathy. And I think so far we've talked a lot about understanding. So how many of you have a better understanding of PTSD now than you had before we started today? Good. I guess I did my job on that part. And just as a reminder what empathy really is, it's the ability to mutually experience the thoughts, emotions, and direct experiences of others. Walking in their shoes, what does this really feel like to them? And it goes beyond sympathy, which is having a feeling of care and understanding for the suffering of others. But true empathy, you really have to put yourself in their situation and try to imagine what this is like for them. And compassion is love in action. And that's what we're all here today for. So if empathy is the ability to really experience some of the feelings of pain that another person is feeling, then compassion is to translate that feeling into action. And it's evident in all the things that we've learned today, in all the exhibits, and all the work that the Wells Center is doing, that we know how to put love into action, don't we? And so finally, let's talk about how, as a Wells nurse, you can identify and assist families in crisis. You know, since I started working with families, I've seen so many things like the drug addictions of people that have had flashbacks and have actually ended up with legal problems and been in jail and prison. Lots of abuse, families living with verbal abuse that nobody really knows about. Severe PTSD, but somebody doesn't want to go get help because it might affect their job. So for you, in terms of being able to care from the heart, how does your heart feel after this presentation? What's one thing that you learned today that you can walk away with?
Oh, our son and daughter-in-law experienced their 14-month-old nearly drowned about a year and a half ago, and they were diagnosed with PTSD. The kids were, she would have nightmares and, have panic attacks and, went through therapy and all that kind of thing. And one thing that I just didn't put the connection to, and now a light bulb goes on, is that she's my dear daughter-in-law is hypervigilant where the kids are concerned, and all they have to do is, when we babysit, we're their only babysitters for the most part, because they can't let anybody else babysit. But yet, if the kids, will babysit, and when Dad walks in the door to pick them up and she's there too, if the kids run to Daddy, immediately she thinks, oh, what happened? That they have to run to Daddy, And at first we're like, oh, nothing happened. They're just letting to see their dad. But she jumps there quickly, and I didn't. At first you're tempted to say, well, we raised 3 kids, we're okay. But now when you look at it in context of this, that's just,
It makes sense.
it makes sense. And I realize that it's not me or my husband that they're,
It's the event that happened.
yes, yeah, that still lingers, they can't, so anyway,
Thank you for sharing that.
yeah.
Any questions I can answer? I know that we've run over, but any questions that, I do have a list of resources, different resources where you can find additional information on PTSD and on training, and suicide hotline for veterans, a lot of good. And then also on the bottom is my information. I've got 2 websites that have lots of information as well. If anybody's interested in my book, I've got books here and some flyers on the books. Feel free. Any questions? Yes.
How did they differentiate your husband's as far as diagnosing him between bipolar or PTSD, or is the bipolar part of it, or did he maybe have that before he even went to Vietnam? anxiety feelings or something, and then that was exacerbated by the Vietnam War.
With the cluster, you know, that's a good question because there's a lot of mental health diagnoses that coincide with PTSD and make them, some actually make you more susceptible to PTSD. In my husband's case, he had never been diagnosed with any other mental health diagnosis, so with him it was strictly the trauma. Although a lot of studies are showing that people that grow up in a dysfunctional family situation aren't as well, so they don't have the resiliency to protect themselves from PTSD, and he did grow up in a pretty dysfunctional family situation, so that may have predisposed him. But there's so much research still going on about PTSD and why two people can experience exactly the same thing, and one person will end up with PTSD and the other one won't. Lots of research still going on, and it varies, but yeah, it's still.
My husband had 3 brothers in Vietnam, and 2 of them were okay. One had PTSD to the max. I mean, where if he heard a plane or a helicopter going overhead and he couldn't touch him when he was sleeping, the whole ball of wax. 2 brothers managed, I'll say, cope with the effects of the war, although this particular brother was a gunner on a helicopter and had some horrible experiences. And all the symptoms you mentioned, and he was drank alcohol, get in trouble with the police, I mean, the whole thing, and he eventually, after ending up in jail a number of times and going through therapy, he actually is better, although he's on medication, but it just your story reminded me of my brother-in-law. And he actually, he did come from a dysfunctional family, went into Vietnam very young, 18, 19-year-olds, before they really had a chance to learn how to cope with life or whatever.
It's amazing how many vets have come up to me and said, "You wrote about me. What you wrote in your book about your husband, I have done exactly the same things." So it's, and I did. I tried to pick out some of the more common things that he did. Yes.
And I just want to make a comment, you know, as nurses, I think one of the biggest things is every person is an individual in themselves, and God created us differently, and really to not assume anything and to keep that door open, you know, to help that. Remember, they're their own individual, and we can't treat everyone the same, because everything is always going to be different.
That is so true, because each one of them has had different experiences, and somebody can experience something just so off the wall, traumatic, and not be affected by it. And for someone else, they'll go, "How did you end up with PTSD?" Because what you experienced was like no big deal, but to that person, that was a big deal. So that's such a good point that they are all individuals, and what they experienced is all so different. And many of them, we will never know the extent of what they experienced.
And each cry will be different, you know, as when they, you know, shout out, you know, and their time span is different. You just gotta, you know, remember their course.
Exactly.
And then we have to stay to the course to help them.
I'm very glad that your husband had someone that kind of took him by the hand to get him help. But if you have a family member and they don't want to talk about it, which most soldiers don't want to talk about what happened, is there any way to encourage them to open up, to see that they need help? My son has spent two tours in Afghanistan, and he's not open about anything.
There is, in fact, let's pass these out. On here, the VA has a really great program called Coaching into Care, and it's actually for family members to learn how to talk to your son, your husband, about what's going on with them and try to help encourage them to get help. They've got some good information on the website, and then also counselors that you can talk to help provide you with the questions to ask and the right things to say, the things to say and the things not to say.
Did your husband ever come to terms with the, how could God let this happen kind of thing? Does he go to church now?
Yes, he goes to church now. And the big reason he didn't stop going to church because of the thinking that God had he wasn't brought up in church,
Okay.
and so, and then before we were married, he just didn't have exposure to it. Nobody that was in his life went to church. So it wasn't about that he was abandoned with him, it was just more never having that as part of his life. When he did go to church for a while, it was more not feeling safe in that situation, in that environment with the crowds and the noise, and especially on Good Friday. I don't know about your congregations, but Good Friday, the end of the service. Yeah.
It's not good to do that.
You need to go out there before the end of the service, yeah, that just really. So if you have anybody in your congregation that jumps, like more than the rest of the congregation. Thank you so much for your attention. I know it's the end of the day and everybody's tired. I appreciate you.
Thank you, Debbie.
Thank you.